Patients who have waited years for medical marijuana in Louisiana can finally get it from dispensaries on Tuesday.
Well, it's been a long road, but marijuana used for medical conditions is finally expected to arrive at Louisiana dispensaries.
This is a big day for my patients. You know, I mean, that's the most important thing as we go through this exercise.
You do get to a point where you are willing to try something that might improve your quality of life. And I trust Dr. Domangue, and I know that he will work with me to see what works. And if it doesn't, then we'll find something else.
To me, it's a very simple conversation. I don't think marijuana is going to solve our problems. It's not. I think it's foolish to think that there's a magic wand that exists in any aspect of life. I look at it as another tool in my toolbox. It is a natural product. It's not going to hurt anyone. It's not going to destroy their liver. It's not going to cause irreparable brain damage. This is medical grade pills, gummies, that are going to be recommended by licensed physicians and monitored and controlled and so forth. Myself and my partner, Dr. Thompson, will be recommending this medication for our patients. The indications that we're going to recommend it for will be anxiety, chronic pain, and muscle spasms, which represents a huge portion of our patient population. But the medicine effect goes far beyond that. It can help seizures, it can help young children with attention deficit disorders, muscle spasms, cerebral palsy. Whether you like marijuana or you don't, or whether you believe in it or you don't, the reality is, what is the alternatives? I can show you gobs and gobs and gobs of medical literature of people dying of aspirin, of Tylenol, of ibuprofen, of alcohol, of narcotics, and the list goes on and on and on. But I can't show you one single article of someone dying of marijuana overdose, not one. Any physician, at the end of the day, needs to fight for their patients. That's why we are doctors. When all this business of hospitals and procedures and surgeries, when we went into med school, we took an oath that we're gonna fight for our patients' health. And again, I don't think marijuana is gonna work for every single patient I have, but the ability to have another tool in my toolbox to battle opioids, to battle anti-inflammatories, to battle major surgeries. There's so many things that damage patients that have negative outcomes. To have something with such a negative risk profile with the possibility of positive outcome, why would you not try it?